Hi, my name is Andi Hamilton, and I will be presenting my project on culturally humble end-of-life care. So just to go over some history and context, modern hospice gained traction in the 1960s. In 1968, Elizabeth Kubler-Ross released her book on death and dying, which highlighted the dehumanizing aspects of hospital end-of-life care. This brought a demand for quality end-of-life care, and social workers became an integral part of hospice teams. In the late 90s and 2000s, social work significantly improved the quality of hospice care by focusing on the psychosocial needs of patients and their families, advocating for their rights, and ensuring access to resources and support. In fact, healthcare social workers led many difficult conversations about life-sustaining treatment, DNR orders, and palliative care options. In 2013, the Cultural Formulation Interview was designed and released as part of the DSM-5 and has been utilized by clinicians to improve patient engagement in treatment planning. And then some ethical and professional considerations. Respect for client autonomy and dignity, informed consent and transparency, justice and equity in care, cultural humility versus cultural competence, and lastly, competence and scope of practice. Hospice care goes beyond just physical comfort. It provides comprehensive support for patients and their families during the end-of-life period. And core tenets of the approach: as long as they have the capacity to do so, clients should have a say in their treatment plan and what care they receive and what care they don't want to receive. And a fundamental piece of this approach is committing to lifelong learning as a professional and being able to critically examine one's skills and decisions. This is why I believe supervision is important and should remain important even after one has earned their SOCW and has, gained tenure, and, it's always important. So because there's a great value in being able to get feedback from someone with more experience than you and be able to hone those skills. Another core tenet is social workers' dedication to understanding and respecting cultural beliefs and values surrounding death and dying. And ethical practice involves open communication about treatment options, pain management, confidentiality, and your support of the client's needs and wishes. The skills that a quality social worker would need include grief and bereavement support, meaning the clinician has substantial knowledge of grief models and the cultural variations in how grief is expressed, as well as an ability to support individuals and families as they process the anticipated loss. They should feel confident in their ability to navigate cross-cultural communication. They need advocacy skills and connections to resources. So in an end-of-life setting, or really any healthcare setting, clinicians should be able to navigate insurance, financial aid, disability, and at-home care. They should have a well-developed list of resources that they can pull from when a client needs something that they themselves cannot provide. They should have strong crisis and emotional regulation skills. And lastly, they should be well-versed in interdisciplinary collaboration. So being able to work effectively with a team of doctors, nurses, chaplains, having so many people on a healthcare team, it should improve the quality of care, not diminish it. But in order for that to be the case, there needs to be strong communication amongst the team members. And really, the social worker should be the one facilitating that and bridging any gaps between team members. And this, I feel, highlights the importance of the clinician in end-of-life work, being able to acknowledge past injustices, particularly those experienced in previous healthcare settings, and then being able to help the patient find healing. So this really ties back into, facilitating closure and helping them find peace at the end-of-life stage. This project is relevant to clinical social work because it requires crisis intervention and coping skills, efforts to empower the client, keep them at the center of the process, conducting a thorough, well-rounded assessment, grief work skills, as well as application of an anti-oppressive approach. And looking at the first limitation here, the skill of the provider is an important consideration. So, what is the clinician's background and experience level in grief and dying processes? Have they ever used a cultural formulation interview with clients in the past? And the risk would be whether the clinician can use the CFI in a natural, conversational way rather than a way that feels very mechanical and detached. So the CFI is designed to be a patient-centered tool where the focus is on the patient's narrative rather than a biomedical perspective. So it's important that the clinician thinks about how each question will make their client feel and allow that to guide them in their assessment, and possibly not ask every question that's on a CFI. So tailoring it to the client. Of course, there's time constraints, so that's another limitation to consider. Important things for the clinician to reflect on would be, how much time do I realistically have to complete this right now? Is my patient in the right state to answer a list of questions? Am I in the right headspace to conduct this interview at this time? Lastly, we need to consider what we know about the patient's culture before we ever even enter the room. So asking ourselves, what is my base knowledge about this specific culture or religion? What do I need to ask the patient to gather more information about their culture or religion? And what info is already in their file? Specifically, what information is in the file about their family or their support system? And lastly, what follow-up questions should I ask to include the perspectives of family? So, because we don't want to assume the patient's expectation of how involved they want their family to be, we have to assess that first, and then we can determine where we go from there. When you're a well-prepared clinician and you can address the client's concerns effectively, it builds trust and confidence in your abilities. And it also prevents the client from having to repeat parts of their story and helps them feel safe and secure with the treatment that they're receiving. And these are the references. Thank you for listening.